Good afternoon. Thank you for being here this afternoon. On behalf of Continuing Dental Education Office, I'm pleased to welcome Dr. Farah Al-Alwani, a special guest from Kuwait. Dr. Farah Al-Alwani, general dentist. Dr. Farah Al-Alwani is a general dentist, certified yoga and meditation instructor, and certified life coach. Dr. Farah is very passionate about supporting people access the highest and best version of themselves. She uses her natural talents and acquired skills to help people achieve more calm, peace, and clarity to stay healthy on all levels, mentally, emotionally, physically, and spiritually. Dr. Farah has been teaching relaxation and searching classes since 2016 and is passionate about guiding others to a state of inner peace, calmness, and balance in life. But today she will be sharing with us her expert opinion and 5 super simple tools to alleviate stress and anxiety for dentists. With that, I ask that you give your full attention to Dr. Farah. Dr. Farah, the mic is yours.
So good evening, everyone, and welcome to today's lecture. Thank you so much for being here today. I hope that you can all hear me clearly. All right, so before we get started, let me share with you my story of why I am actually doing this. So Dr. Yusuf kindly did an introduction on my background, and yes, I have been doing such courses since 2016. And why did I even start with this? Well, the reason why I started was because I did go through a period of my life where I was stressed out. Sorry, can you please mute your mics because we don't want any interference. You can hear me clearly, right? Okay. Bear with us, Zoom is a technical device, so we're just trying to get to mute themselves. I'm going to mute everyone. Okay, let's see. I think we're all muted now. All right, so how about we start with just a few guidelines. I can't seem to go back on my slide. All right, so before we start, I invite you all to just give me your full attention for the next 85 minutes, okay? And I promise you I'm gonna make it worth your while. And we're gonna start just by disconnecting ourselves from everything external and just bring all your attention here. We're going to shut off our phones. If you're not using them right now, please turn off your applications. And let's start with a breathing exercise, just to center ourselves to this moment. You may be at home, you may be in the office, and I see that most of your cameras switched off. That's okay. All I do ask is for you to participate in this workshop, which I'm so excited to share with you. So let's start with a centering exercise. What we're gonna do is we're gonna close our eyes if you feel like it, or just soften your eyes and bring your awareness to your breath. So just notice how you're breathing. All right. Is it coming, are you breathing from your nose? Are you breathing from your mouth? And we're going to, together, I'm gonna guide you into a simple breathing exercise just to allow you to bring your whole attention here in this present moment. So I invite you to just exhale all the air out wherever you are. And we're going to inhale together for 4. Inhale, 2, 3, 4. Hold for 4, 2, 3, 4. Exhale from the nose for 4, 2, 3, 4. And hold again for 4, 2, 3, 4. 2 more rounds. Inhale. Hold. 2, 3, 4. Exhale from the nose. 2, 3, 4. And hold. 2, 3, 4. One last round. Inhale. Hold. And exhale from the nose. Hold. And you can breathe naturally now. Notice where you are. And I hope that you feel what I feel. I'm definitely much calmer. All right, so let's go back to my story. Now, there are so many things that you're gonna learn today that you already know, okay? The first part of the lecture is designed to speak to the mind so that you get the scientific knowledge of what's really happening in your body when you do such breathing exercises. And the second half is designed to show you those 5 super simple tricks and tips, all right? So let me share with you my story. The reason why I got into this whole thing was I did go through a period of my life which I would call a burnout experience, where I was overwhelmed with life's responsibilities. I was working in the clinic 5 times a week. I just recently had 2 babies. I had a lot of drama happening at work, at life. I wasn't sleeping very well. I was breastfeeding my kids, so I was sleeping on average every 2 hours. I would wake up every night. So you can tell I was completely exhausted, mentally, emotionally, physically, and spiritually. And initially, I'm the kind of person that loves to move her body. So I would be at the gym for 2 hours at a time before having my kids. After having kids, my life just got turned upside down. And I'd go to the gym and I couldn't physically move my body. It was too painful. I was in too much pain. And then I discovered these stretching classes. So I would say, you know what, at least I'm doing a class. And I entered these classes where I would learn how to move my body in a gentle way and how to breathe in a proper way. And I would go in frustrated, anxious, lots of thoughts in my head, and I would leave in a state of complete calm and confidence. So I thought to myself, what is this? What is the going on here in this class? What is happening? And after a while of practicing, I noticed that my body started to actually feel good. I was stretching my muscles, so I was getting some kind of toning happening in my body. More importantly, I felt more connected to myself. So if you feel any of those feelings, I hope that today's lecture or workshop is going to help you. As I said, I hope that you will participate with me. I cannot tell if you're doing it, and this is all for your own good. So these are my contacts. I have an Instagram, I have my website, and if you would like a PDF of this presentation, please email me and I will for sure send it to you. All right, so let's move on. Technology is a little bit slow, so just bear with me. So how this lecture is going to go, I'm going to explain to you what is happening when your body is in stress, what's happening to your mind, what's happening to your body. I'm going to tell you the science behind it, and I'm going to share with you those simple techniques, which we will do at the end of the exercise. All right. Just bear with me, it's not moving. This has never happened before, but it's okay. So we're going to start with a definition of what stress is. All right, we all know what stress is, right? It's, there we go, it's moving. So these are the things that we'll talk about, how to identify the symptoms of stress and anxiety and to differentiate between them, how it affects the mind and the body, how to rewire yourself, your brain towards calm and resilience. And again, the 5 super simple tools. All right, happening here. Okay, so definition of stress. Stress is a physical, mental, or emotional factor that causes bodily or mental tension. We've all been there, right? It can be external, due from the environment, could be psychological or social situations. Yeah, some people get stressed out when they have a wedding to go to, social event, especially now that we're all in this super strange circumstances of COVID. It could be internal as well, due to illness, or if you've just come out of a medical procedure, then it can be an internal experience. So you should know that stress is a person. It's not all stress is bad for you, actually. You know, long-term stress can definitely harm your health, and there are so many ways to manage the stress. So make sure that you do ask for help from a healthcare professional, just to get that out of the way. So what are the causes of stress in the dental profession? So let's go back to our profession. Yeah, we're not going to talk about any other external stresses today. We're not going to talk about COVID or homeschooling or all the lovely things that we're going through. Let's just concentrate on our profession. So this is not an exhaustive list, all right? So one of the stressful things is we do work in a small space. First of all, the oral cavity is extremely tiny. And second of all, the actual room where we are sitting is very small, and you feel like you are actually confined to that small space, and there's only you and the assistant right next to you, which can cause a lot of stress, you know, especially if you're the kind of person who doesn't like to be very close to other human beings. You know, you need a lot of your own private space. The second reason, isolation. So a lot of the times we do work alone in the clinic, and when we are faced with a difficult situation, for example, a difficult extraction, you feel like you are alone because you're trying to deal with the situation right now, especially if you have a waiting room filled with patients. The second thing is the stress of imperfection. We all know the experience of trying to create a beautiful composite anterior filling on a patient with gingivitis. And you know how that feels when there's so much blood going on, and no matter what you do, it's not stopping. Yeah, and you really do want to give the patient the best service you can. So that also causes some stress. We have stress of economic pressures. We have time pressure. We need to finish up. We have patients waiting for us outside. Compromised treatment frustration, knowing that you cannot give the patient the best thing when a patient comes in and they can't afford to do the root canal, they want an extraction, and you're trying to convince them and you're like, please listen to me, and they don't want to hear it. Patient anxiety. And this is the thing that really led me down this path. My curiosity came when I thought of ways of how I can help ease the patient's anxiety. And of course, we have the dentist personality. So here's an article published by the British Dental Journal in January 2019, which said that researchers found high levels of stress and burnout amongst a survey of more than 2,000 UK dentists, among whom almost a fifth of them admitted they had seriously thought about committing suicide. Now that is a scary rate. That means if we go by the statistics, 20% of us here on the call may have thought about committing suicide. So what's 20% of 50? That's about 10. So imagine if 10 of us right now are thinking about committing suicide. That is an extremely large number. All right, and reportedly, currently the people who are experiencing the highest job stress are general dental practitioners. All right, so let's look at another article that says the Swedish Dental Association claims that due to occupational hazards, dentists live 10 years less than the total population of the country on average. Why? Because of all the stress that they're subjected to, emotional exhaustion, tension, sadness, anxiety. All these things mean that, you know, you're losing 10 years of your life. Very interesting. I found this extremely interesting, and this is tried to get the most recent research. This is on 7th of January 2021. So it's a US paper that says that research shows 75% of dental professionals complain of musculoskeletal pain. That's not new, right? We all know that because of our job, because of what we do have higher levels, higher experiences of this kind of pain. But now that COVID pandemic is here, there's an additional stress caused by the physical exertion, caused by the PPE wear that we are wearing all the time. And dentists have noticed that there's an increase in neck pain, fatigue, headaches, or dehydration. The heavy PPE causes us to use the body improperly, which results in increased stress, headaches, dehydration, and fatigue. So now let's talk about anxiety. I think you do have a fairly good idea of what stress is. Now, what is anxiety? This is something that I discovered recently. I thought that stress was everything, but clearly it is not. So anxiety is actually a feeling of worry, nervousness, or unease, typically about an imminent event. So it's a future-oriented event or something with an uncertain outcome. So what is the difference? The difference is it seems to be always there. You seem to be always worried about something, whether it's taking days off work, whether it's the inability to travel, whether it's the online schooling of the kids. Whatever is happening in your world, you seem to be always worrying about something new. So this is not stress. This is actually anxiety. 4 behavioral definitions of anxiety. Number 1, excessive or unrealistic worry that is difficult to control. So you feel like you're out of control. Your mind is out of control. It's always happening, and it's happening on more days than not during the week. And it's happening for a period of 6 months. Motor tension. Yeah, so you're getting restlessness, tiredness, shakiness, muscle tension in your body. Autonomic hyperactivity, so you're getting those heart palpitations, shortness of breath, dry mouth, and nausea. Hypervigilance. This is a very interesting one. You feel like you're always on the lookout for danger. Yeah, you feel like you're on edge. And that creates a feeling of the inability to fall asleep. It's difficult for you to concentrate. So I hope that creates, I hope you have a kind of knowledge now of what's happening and how it's affecting you. All right. So anxiety is an epidemic. It's affecting everyone, not just dentists. So let's just briefly go over the difference between stress and anxiety. So stress is an external cause, has an external cause. It's a natural response to a challenge. So for example, if you have an upcoming exam coming up, you have an important event coming up, you want to be well prepared for it, you go through that, you have the feelings of racing heart, you have the feelings of nervousness, frustration, maybe overwhelm. And then when the event is gone, the feelings are gone, you go back to normal. Yeah, life goes back to normal. Anxiety, however, it actually has an internal origin. So I've experienced this several times. It's a feeling where your thoughts are like racing at the speed of light, yeah? Racing thoughts leading to a feeling of complete out of control. For me personally, I even start to drop things, you know? It becomes like, you know how we talked about the motor tension? You start to drop things, you're unable to hold things. People start to say, why are you so clumsy? Especially the people who live around the house with you and they're noticing what's happening in your life. Yeah, so you do get the same symptoms of stress, but they are much stronger, such as panic attacks, pounding heart, like there's no mistake in that there is something inside of your rib cage that just wants to burst, yeah? You're having dizziness, you're having chest pain, you can't sleep for long periods of time. So it's not just because of an event or because of something new. No, you're having some kind of insomnia problems. Yeah, and they are persistent. Like I said, stress goes away, but this doesn't seem to go away. It may subside for a while, but it's just always there in the background. Yeah. So Hans Slay says it's not stress that kills us; it's our reaction to it, which leads us to understand that not all stress is bad for us. There is such thing as eustress. So I like this human performance curve. And as you can see, I love infographics because they speak to us on so many levels. And just having a quick glance at this beautiful curve, you can tell what is happening. So according to your stress level, you can get a measure of your performance. And in my belief, it is completely personal. So if you're not really having enough stress load, you start to get inactive, you start to get bored, you start to get lazy, feeling of depression, uninterest in life, yeah? So your performance isn't really that high. But if you have an optimal level of stress, that's when you're performing at your best. Yeah, for example, if you're in and you know that you have 10 patients and you've already done 6 of them and you only have about 2 hours to go, you're feeling really good. You're like, I can do this. I only have 4 patients outside. I have a couple of hours to go. I'm okay. I know I can do this. Yeah. What happens when it's around 6 p.m. and you're supposed to leave around 8, say 8:30, it's about 7 p.m. and then you have 3 patients walk in with a facial swelling or with a child that's in there crying their eyes out, uncooperative. You start to get a little bit stressed, yeah? So, and then you sort that out. And then what happens if you're like this every single day? I remember a time when I was working in the clinic, I was covering for some doctors who were on vacation, and this place was extremely busy. So I would see about 20 to 25 patients a day. At first, I was super excited. I'm like, yes, this is so much fun. I get to see a variety of cases. This is so interesting. And then by day 5, I was like, that's it. It's enough. I can't focus anymore. I need to just go home and rest. Yeah, we all have our own limits. So what happens to us when we keep working at that level? When we keep working in a place where you're constantly overloaded? The curve shows there's a peak and then it starts to go down. You start to reach what's called a burnout. And this is a complete no-no, a place where I hope that none of you have to go through. And it's a space where you feel like you just want a vacation, you can't move, everything hurts, you can't function, yeah? And then you're no good for anyone, no good for yourself, no good for your family, no good for your job. And especially now with what we're going through, there is not really much opportunity for us to take many vacations. There's so many restrictions on us. So what do we do when that happens? So yes, let me just go through some examples of positive stressors. So positive stressors, which can really boost you to get excited about something and do like perform at an optimal level, such as starting a new job, receiving a promotion at work, going on holiday or vacation. For me, going on vacation is like extreme stress. It like completely pushes me off the edge because I'm super organized. So I have to think about so many things and I have to write all my lists and I have to make sure everything is packed and I just go nuts. So for me, it is not eustress. Perhaps it is for you. Moving into a new home, learning something new. Yeah, we've all been there. And I totally encourage you all to go out there and explore the world outside. There's so many things, so many beautiful arts for you to learn outside of our scope of field that will really help you to stay more centered. Negative stress, death of a significant person. Perhaps someone close to you has contracted COVID, or maybe someone elderly in your family is just in home confinement and you're constantly worried about them because you don't want them to catch it, right? So yeah, we can have so many, could talk about this forever. So let's go into what stress does to your brain and your body, because this is the important part. Now, we all know about the nervous system. We all learned this in college. I know I did. We have the central nervous system, which is the brain and the spinal cord. Yeah. And then we have the peripheral nervous system, which is your cranial nerves, your spinal nerves, your sensory organs. And this is the important part for today's workshop. So the peripheral nervous system split into two, somatic and autonomic. Somatic is voluntary responses like breathing. We did a breathing exercise before we started. That was completely voluntary. And then we have autonomic, which is involuntary responses, such as those related to homeostasis. So let's talk about the nervous system. So the nervous system, what does it do? We know that it regulates blood pressure and our rate of breathing. And the system works automatically, thank God. Yeah. It's made up of the sympathetic and the parasympathetic nervous system. And I'm so happy that I can use these big words here. All right. So our body is constantly trying to keep us in a state of homeostasis. We all know this, yeah. So homeostasis is a dynamic balance between the autonomic branches. So I see it as a seesaw, yeah. It's somewhere where we're trying to keep a balance between the two. And we know that other words for sympathetic are fight or flight or freeze response, yeah. And another name for parasympathetic is the rest and digest response. So we're always trying to keep them all in balance. So what happens when we are going through an experience where our sympathetic nervous system is kicking in? And why is it kicking in? Obviously, it kicks in because that's our body trying to protect us from danger. Yeah. It's our body and our brain are super, super intelligent. And obviously this is something from prehistoric times where we're programmed to run away when we get chased by a saber-toothed tiger or a lion or something. Yeah. And what happens is, systematically, what happens is it affects your organs, and what it affects mainly your eyes. They start to dilate so that you can see in front of you, right? And you're going to have that tunnel vision to make sure that you're going the correct way. You're hypervigilant. You're trying to find a place where you're going to run away from this tiger. Your heart's racing really fast. It's really strong because it's trying to pump all the oxygen to your limbs, your skeletal muscles, so that you can run and escape. And what does that do to your breathing? Obviously, you're going to be breathing very shallow, just maybe upper chest breathing. Yeah. So we're not being chased by tigers anymore, are we? No, I think none of us are, thank God. But we are being chased by our mind. Our mind is creating stories for us. Yeah. And the mind doesn't know whether something is real or imaginary. Yeah. And that explains why a lot of us, when we come down to put our heads to rest, we suddenly start to get all these symptoms. We remember maybe one, let's say an obnoxious patient or some event that happened to us, and we suddenly cannot sleep. Yeah, because our mind has gone into fight or flight or freeze. And it's designed to help you to either fight, yeah, to fight the situation so that you can get what you need to get done, yeah, or freeze. Freeze is where you just kind of go blank. This used to happen to me a lot when I would be in extreme like social situations. I would just not be able to function really, yeah, or fly, just get out of there. Yeah, like what happens to you when you're in your clinic next door working so peacefully and you hear your colleague next door having to deal with a really upset client or patient screaming their head off? Yeah. And you're like, what is going on there? You're not in the room, but then you start to develop the symptoms. Depending on your personality, you will get affected. We are human beings. Yeah. So you will develop any one of those symptoms. You're either going to want to drop what you're doing, go in there and save your friend, your colleague. Yeah. Or you're going to want to just get out of there, just finish whatever you're doing and just go out and have a smoke or just get out of the whole situation. Or you just freeze and you're like, what do I do? Yeah. So that's just giving you some real case scenarios. And when we're at that level, so that is a good place to be when you need to save yourself. Yeah. When you're in a situation where it's life or death. Yeah. Or you're in that situation. But if you're there at a constant level where you're always feeling that, you know it's going to affect you on a longer, a long life, right? It's going to affect your organs. It's going to affect your systems. Now let's talk about parasympathetic. What happens? So you're in the clinic and you experience this where you're hearing people fighting about something, and you're done, but everything is resolved, but you're still feeling the shakiness. You're still feeling like, kind of scared. And then the shift is over and you leave and you sit in your car and you're like, thank God that's over. Oh my God, I'm so ready to just get rid of that day. Yeah, especially if it's towards the end of the day. And you sit in your car and you kind of like, oh, I feel so safe. And you lock the doors and you're like, okay, this is my safe haven. And then you start to kind of slowly calm down. Yeah. So what happens in your body after a while? Or you may not even calm down until you get home. Yeah. And you get in your room or you take a shower and you're like, wash it all off. And you're like, oh, that feels so good. What's happening there? Suddenly your heart starts to beat more slowly. You're breathing, your lungs start to open up, and then you can breathe deeply all the way down into your belly. And then your digestion starts to kick in. So you're starting to get hungry, you want to eat some yummy food, yeah. And then all the blood goes to your digestion, yeah. So you're able to digest that food and you're feeling like really good and safe. But why do we have to wait that whole time? Like, I don't know how long it would take for you to reach that. And some of us, we are in chronic stress all the time that we can't even let go until we go on vacation. So this is just an infographic about what happens to you when you go to fight or flight. Just want to check the time. Okay. So what happens in your body? So obviously stress is going to affect your entire being. It's going to affect your brain. It's going to affect your cardiovascular system, your joints, your muscles, your immune system, your skin, your gut, your reproductive system. It may show up in different ways. And how is it going to affect you? We don't really know. It's going to affect you where your body is weak. Yeah. And only you know that from previous experience. Like I know, for example, when I get really stressed out, maybe I'll break out, my skin is going to start breaking out, and then I won't be able to eat. I won't feel like I don't have an appetite. And then when that continues on, I'll catch a cold. So just be aware of how stress is affecting you, because this is your body trying to talk to you, trying to tell you, please help me, please save me. Yeah. So this is an assessment for stress levels. Okay. Just go through this and notice how many yeses do you say to these questions. Okay. So do you experience any of the following symptoms? Headaches, chest pain, muscle tension, nausea, or changes in your sex drive? Do you experience fatigue or struggle to fall or stay asleep? Do you worry excessively? And do you feel overwhelmed with all your responsibilities? Do you struggle to focus on tasks or stay motivated? Do you have little appetite or find that you are overeating? Do you struggle to regulate how much caffeine or tobacco you use? So I've spoken to some of my colleagues and they've explained to me the amount of caffeine they drink during the day, especially when they're on night shifts. It is absolutely ridiculous. You are doing your body no favors whatsoever. Yeah. So this is no judgment. We all deal with what we have, with what we're given. Yeah. But just be aware of it, because the number one rule for me of changing anything is awareness. So this is by no means a subscription for you to judge yourself or judge your colleagues or judge each other. Yeah. No, this is not the way. This is just to bring awareness to what's happening in your life. And lastly, do you withdraw from others or do you feel overwhelmed in groups of people? So these should all signal to you that something is going on with you. And remember, if it's anxiety, then it's long-term, it's happening very frequently. All right, let's go to the next part. So how do we regulate the nervous system? We tone what's called the polyvagal nerve. So what does the polyvagal nerve do? Or we can call it the vagus nerve. It basically downshifts the nervous system. So this is a theory developed by Stephen Porges, and the polyvagal nerve is a wandering nerve that touches most of our organs, and 80% of its fibers go from the body to the brain. So as you can see here, there's a lot of, this nerve touches a lot of the different organs in our body. And if we can downregulate that nerve, if we can just activate that nerve, automatically it's going to send a reaction to our brain. It's going to calm us down and kick in the parasympathetic system. So the vagus nerve is the longest nerve in the body. And as I mentioned, it connects your brain to many important organs, more specifically the gut, the heart, and the lungs. All right, so as I said, it's the mediator of the parasympathetic response. It sends a message to reduce your heart rate. It releases anti-inflammatory chemicals, releases acetylcholine, which causes a brake for the heart. So it's like you're putting on the brake on the engine, which is the heart. And it's the chief neurotransmitter of the parasympathetic nervous system. All right, so how do we assess? There is a way to assess it. We check the heart rate variability, which shows us our health, vitality, and elasticity of the heart. But before we go there, we don't really need to go there. As I said, the first thing I want you to do is just be aware of what's happening in your body. Yeah. And if you have a higher polyvagal nerve tone, then your body can relax much faster after stress. And if you have a lower one, then you have chronic anxiety. It becomes really, really hard for you to calm yourself down so fast. So let's go into tool number 1, which is breathing. We started with a breathing exercise, and we all know what breathing is. Yeah, I mean, we all breathe. Who doesn't breathe? If we go a few minutes without breath, that's it, we're done. We all know that, right? But the question is, are we breathing correctly? Yeah. And how many breaths do we take a day? I found this extremely interesting. We take about 20,000 breaths per day. Now, we are breathing, but we're not really breathing correctly. And most of us are actually chest breathers. What happens is we're actually supposed to breathe all the way down to our diaphragm or belly breathing. And that is where you're using the full capacity of your lungs. So as you can see in the diagram, when you inhale, we're talking about nasal breathing. Okay, so mouth breathing is something that we only resort to when we really have to. For example, if you're doing some exercises, you're exercising and you need some more air, then you're going to open your mouth. Or when I'm speaking and I'm breathing, only because I have to. But I highly encourage you to go more for the nasal breathing. If you have no obstructions or any issues there, then just focus that you're doing the breathing from your nose. So we're inhaling from the nose, the lung volume increases, the rib cage expands, and the diaphragm contracts so that you can actually create a negative pressure, allowing more of that air to come in. And obviously we do know that we breathe because we want more oxygen in our body and we're trying to get rid of the carbon dioxide. Okay, when we breathe out, what happens is our diaphragm relaxes, it moves up, the rib cage contracts, pushes the air out, and then the lung volume decreases. So this is a fun fact that I discovered yesterday. They say that you can breathe 15 times per minute. And if you breathe 15 times per minute, you're going to live to 75 or 80 years, which is the average. Yeah. And if you breathe 10 times per minute, you will live to 100. So I encourage you to try that one out, definitely. And by the way, don't take anything that I say or you learn today as 100% truth. So I do encourage you to try out these exercises and just really observe your body and see if any of these things do really resonate with you. So the respiratory system is made up of the nose, the mouth, the throat, the trachea, and the lungs. So while the diaphragm is the main breathing muscle, there are other muscles in our body, such as our ribs, our abdomen, our neck, and our shoulders, that support your ability to breathe. So when you're breathing, you should feel the whole expansion, the front, the sides, and the back of your body. Now let's briefly talk about why breathing is so important. So It is the most important function of your body, and it does affect you in a multitude of ways. Number one is related to your immune system defense. When you breathe in oxygen, your body creates what's known as superoxides, helping to fight against bacteria and viruses in the body. And especially with the COVID, you know that it does create an issue with the breathing. And they do encourage you to actually keep breathing, even if it's painful, even if it's difficult. You need to just keep on utilizing your lungs and your whole entire breathing system. Cognitive clarity. So the brain uses 20% of the oxygen that you breathe because it's processing everything that happens within your body. So your brain is eating up a big chunk of that oxygen. Essential healing powers. So when you've been wounded or injured, your body needs some serious oxygen body heal itself. Muscle management. So for those of you who are sporty, you know that when you're active, your muscles start to get a little bit itchy or they start to cramp up. That's because they're using up a lot of oxygen during that time. And they do use it up faster than the blood can replace it. So what I usually do is I do train weights. So when I do go to the gym, I make sure that before I start my cardio, I do take a few breaths. And then in between my reps, I do take deep breaths. Yeah, so just be aware of where you can actually pause and take more deeper breaths that can serve your body better. All right. So breathing consciously. What is breathing consciously? Let's talk about unconscious breathing first. Unconscious breathing is controlled by the medulla oblongata and the brainstem, which is the primitive part of the brain. So it basically does everything for you. It's completely automatic. You don't have to think about it. That's why we're breathing right now, even though our body's doing so many things that we're not even aware of. Now, what I want to emphasize is conscious breathing. So conscious breathing comes from the more evolved areas of the brain, such as the cerebral cortex. So therefore, deep breathing and slowing down the breath has a relaxing and balancing effect on the emotions. Why? Because the cerebral cortex is in the part of the brain that is related to the limbic system, which is related to emotions. That means if we can control our breathing, that means we can control our emotions and shift our state, the state of our mind, the state of our body, the state of our emotions. All right, so in essence, by consciously breathing, you're controlling which aspects of the mind dominate, causing your consciousness to rise from that primitive instinctual fight or flight or freeze to the more evolved and elevated, so that you can actually think in an even better way, which makes you feel safe. So that's our target, basically, for us to just shift from that, oh my God, I'm in danger, to I'm okay, I'm safe, I can handle whatever's coming my way, I can handle it. Those are the basic messages that we're trying to shift in our mind. So the breath controls the mind, the body, and emotions. By changing the breath pattern, you can produce a different state of mind. We already talked about that. So here's a visual. I love visuals. So we talked about the lizard part of the brain, which is the automatic part, the fight or flight. It's in the brain stem, as you can see. And that gets triggered when you're doing the fast breathing. And you're breathing at a higher speed, you're obviously in fight or flight, yeah? And when we shift into conscious breathing, we can start to activate the limbic system, which is the center for emotions, memories, habits, and attachments. However, what I do want to encourage you to do is to actually activate the prefrontal cortex of your brain, which is the highly advanced part of your brain, which is the executive thinking mind. You can think of that part as the big boss. And the more we train ourselves to breathe in a deep way, in a proper way, at a regular basis, the more we activate that part of our brain, so that when we are actually in a situation where we would automatically usually go into fight or flight, we can easily shift into that executive thinking and do a much better job or create much better choices for yourself and basically get yourself out of a difficult situation. All right, so before we go any further, let's talk about the cardio coherence breathing. So the breathing that we did before it's called the square breathing, which is we're inhaling for 4, holding for 4, exhaling for 4, and holding for 4. So this is called the square breathing, where you're breathing and then you're holding for a while, and then you're breathing and then you're holding for a while. And that is an excellent way. If you like that way, you can keep using it. I want to introduce you to something else, which is the cardio coherence breathing. And this may be a little simpler. I've been trying it. I've been using it for the past few days. And it's basically a deep belly breathing, which calms and tones the nervous system, the vagus nerve. And how do we do it? It's much, much simpler. It's much, much simpler. And what we're going to do is we're going to inhale for 5 seconds and then exhale for 5 seconds. Inhale 5 seconds, exhale 5 seconds. If 5 seconds is too much, we can do it for 4 seconds. And that's it. You don't have to hold it. You don't have to think about it. And it helps because it helps to just calm down the whole cardiac system. And also when you do the belly breathing, you get to activate the bronchioles and the alveoli in the lower part of the lungs, which have a greater capacity to transfer the oxygen into your bloodstream. So let's do that now together. So I invite you to just sit up straight, sit up tall, rolling your shoulders back. And we're going to inhale for 5 and exhale for 5. Okay? And I'm going to guide you. So for now, let us all just exhale all the air out. And inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Do the next one on your own. I invite you to place one hand on your chest and one hand on your belly. And just be aware of what's happening in your body as you're inhaling. The best way for you to breathe is when you inhale, you're sticking out your belly so that you can fill up the lower part of your lungs. Just relaxing that belly. And as you exhale, you're going to feel that your chest is depressing. And as the air is leaving out of your lungs, you feel like your belly is being pushed in. And it takes a bit of practice. And you can try this out and keep practicing it at your own pace. And I would love to know how you're feeling in the chat. And I also invite you, please, so that you can register your points for this beautiful lecture, just to make sure that you're signing in using the link shown in the chat. There should be a link there, and you can use your mobile number as the requested student ID. Please note that if you do not sign in, you will not get the certificate of attendance and you will not get those super valuable 2 CME points. So I'm just going to give you a few moments to do that. By the way, if you have any questions, you can place them in the chat and I'll get to them at the end of the lecture. So I can't see anyone, but I'm going to give you just a minute to do that. I have the instructions in the chat there. I think the chat is blocking the video. Okay. All right, so let's keep going. I want to use every valuable minute that we have here. So we talked about the square breathing before, and we talked about optimal breath. So optimal breath is when we're breathing deeply, we're having long breaths, we're breathing with the abdomen, we're breathing with awareness, we're breathing with attention. It's consciously directed. It's calming and soothing. I hope that you've experienced that now. And it activates relaxation. Another kind of breathing, which I also use sometimes, is the 4-7-8, which is inhaling for 4, holding for 7, and exhaling for 8. And then inhaling again without a stop. So by us, if you notice the numbers, we're doubling the exhale. So if 4 is too much for you, you can do 3, 5, 6. And when we double the exhale, it actually does also activate the vagus nerve as well. All right, so here's the research that talks about the effectiveness. I know we all love science and research. So in 2015, Stefania Doria and her colleagues in an Italian hospital offered 10 training sessions of 2 hours each, spread out over 2 weeks to 69 patients with anxiety or depressive disorders. The training included a variety of set of breathing. Obviously, there are so many different breathing techniques, and I wanted to give you out the simplest, but there is such thing as abdominal breathing, acceleration, deceleration of rhythm, and alternate nose breathing. And they also combined that with some stretches of the body. And the researchers observed a significant decrease in their symptoms at the end of the protocol. And even better, improvement was maintained 2 and 6 months later, with follow-up sessions just once a week and some home practice during this period. So imagine that they could be people who are on various number of medications, you know, maybe they will have a reduced number of medications. Maybe eventually they can come off the medications just by simply breathing. I mean, this is something really amazing that you can actually access the healing power of your own body just through this kind of technique, which is just breathing. On to number 2. So number 2, singing and humming. All right. So again, Dr. Stephen Porges recommends doing breath work, breathing, and then chanting or singing, making sounds to tone the vagus nerve. So shall we sing? Are you ready to sing with me? Okay, so we're not going to sing. Okay, we're going to do this beautiful breath work also, which is called the humming bee sound. So I can't see you, but I hope that you are going to do it with me and notice the effects it has on your body, because it is beautiful, beautiful, relaxing feeling, emptying of the mind as well. So I'm going to demonstrate to you the first round, and then we're going to do it for another 3 rounds together. All right. So just as the beautiful lady in the picture is doing, we're going to sit up with a tall spine, and we're going to plug our ear flaps with our thumbs, open up the elbows to the side, and then we're going to place our fingertips on either side of our head. Okay, and I'm going to demonstrate the first round. I'm going to inhale in through the nose, and I'm going to make a humming sound. Okay, and I invite you all to do that. I can't hear you, so please go ahead and enjoy this experience. And each one of us will be going at our own pace, and that's okay. So just watch me for the first round. We're opening up the shoulders. We're opening up the arms. Inhaling. So please join me. We'll do this 3 times together. And when you're done, please place your hands on your lap. Inhale. Bringing your awareness to the state, how are you feeling? And I want to include a small visualization here. Just imagine that there's a white light that's cleansing the right side of your brain. Just imagine a white light there, emptying out that side of your brain. Imagining that your brain is empty, free, calm. When you're ready, you can open your eyes. I definitely feel more calm, and you can sense that, I'm sure. I'd love to hear from you, so please, if you've joined me, place your comments in the chat, and I'll get to it at the end. All right, so that was tool number 2. Tool number 3, spinal flexion. So spinal flexion is basically where you're bending the spine, and this one also massages the vagus nerve. Okay, and it has a name when we're doing it on the floor, or we call it seated spinal movement. So we're going to practice this now. If you're sitting on a chair, just make sure that you're sitting with your spine tall. Your feet can be on the floor. Placing your hands on your knees. And you can watch me for the first round, and then again, we'll do 3 rounds together. And what we're going to do is, if you have any, just disclaimer, if you have any cervical discs or any kind of disc issues, please be careful with this exercise and do not bring your spine, your neck all the way back. You can just keep it straight, okay? So we're going to inhale, bringing our neck back, opening up the chest, rolling the shoulders back, pushing the belly out. And then exhale, rolling our spine, rolling our shoulders inwards, bringing our chin to our chest, pressing the abdominal muscles. All right, you can join me now. Inhale, opening up the chest, sticking the belly out, rolling the shoulders back. Exhale, hunching over, bringing your shoulders close to your ears, chin to chest, tucking your pelvis in. All right, 2 more times. Really give it your best. Inhale. Exhale. One last time. Exhale. All right. When you're ready, you can come back. I know that feels super good for me. I hope it feels good for you too. So that was tool number 3, spinal flexion. So you can do these in between patients, okay? This one also goes along. I'm sneaking another one in, which is moderate exercise. Yeah. So we have this idea that exercise needs to be like running or jogging or going to the gym. It's okay that if that's not what interests you, find something that interests you. And the simplest thing that you can do, something really practical, is just stretching your body in between patients. Yeah. Lifting your arms up, really stretching, doing your twists. Yeah. Shaking your arms out, giving some hand rotations, some ankle rotations. You know, when we're working, we use our whole entire body. You can even rotate your eyes around the room a few times. All these simple exercises don't take much time, and you can do them right where you are at your work. Yeah, you can easily do the breathing exercises. I think now we're getting a bit more leeway in between patients because we're doing a super job cleaning up the place. So you have about 5 minutes to do these simple exercises. So it is recommended that you do 2 to 4 times of exercise, 25 minutes or more. Studies show that intermittent forms of exercise can improve the cortisol balance. And as you know, I do stretching, yoga, meditation, all these things, but specifically this kind of stretching helps to massage the internal organs and the glands, squeezing the adrenal glands and flushing out the kidneys and the liver, increasing circulation in the body, flexing and mobilizing the spine. All these actually physically help your internal organs, so help you to regulate the adrenaline, the cortisol in your body. Tool number 4 is visualization. So it's recommended that you do it 3 times a week for 10 minutes. And it actually relaxes, again, does the same thing. It relaxes the parasympathetic nervous system, calms the body-mind. Yeah. So how much time do we have? Okay, so let's just do something together. What we're going to do is I just invite you to soften your eyes. You don't have to close your eyes. And this is an example of what you can also do at home. So just again, coming back to yourself, bringing your focus and your attention inwards. Let's do the breathing. Let's breathe in for 4 and out for 4. And just notice your shoulders, allowing your shoulders to relax, allowing your facial muscles to relax, allowing your scalp to just relax. Visualizing a wave of relaxation just flowing from the top of your head all the way down your spine, down the front of your body, relaxing your arms, your fingers, relaxing your hips, traveling all the way down your legs, down to your baby toes. Continuing to breathe. And now I want you to remember the best vacation you ever had. And in that vacation, just remember one point in that vacation. It could be a time when you went to visit a natural, beautiful site in the mountains. Could be a time when you sat by a lake, beautiful expansive lake in front of you, the birds were singing. Could be a time when you went swimming under a waterfall. Whatever it is, just I want you to recall that memory. And recall it like you're reliving it, like it's really happening now. Continuing to inhale and just relaxing the body, relaxing the mind. Just take yourself to that memory. Notice what's around you. Notice the air. How did the air feel at that time? Notice what you're seeing. Notice the smells, the sounds. Notice how your body feels. Notice who was with you. Maybe you were with your loved ones. Maybe you were having a wonderful meal. And just stay there for a moment. Maybe you're starting to get a flood of happy memories. Allow that to come, but just focus for now on one really meaningful memory. Notice how your body feels. I didn't do anything. You did it on your own. Just through your breath, just through your relaxation, just from your own memories. This is what a visualization is. And starting to move your fingers, you can rub your hands. You can start to massage your face, bringing yourself back to the present moment. So that took all of 5 minutes. And I know I'm definitely super relaxed. And because I do this all the time, I do this very often, my body is kind of programmed so that as soon as I close my eyes, happy feelings start to rush through my body. My body automatically starts to relax. You don't have to close your eyes. It's entirely a personal experience for you. You can just soften them so that you're not like staring, using all your energy staring at something. All right, so that was our tool number 4, visualization. Studies show that after 4 months of doing this, you get higher levels of testosterone, which is going to help you to feel more happy. It's going to give you more courage, more confidence, which is going to help you deal with life, because life is always happening. Higher levels of DHEA, higher human growth hormones, and melatonin, which is going to help you to sleep. So I challenge you to do this just before you sleep. And you're going to notice a big shift in how you sleep and the kind of dreams you have if you do dream, and how you wake up in the morning. Again, you can do this 3 times a week, 10 minutes a day. It took us 5 minutes to do it. I know I was guiding you, but you can do this as well in between your patients. All right. Last one is called Eft Tapping. So this is a powerful holistic healing technique called emotional freedom tapping. It's so easy to do. And has proven to effectively resolve a range of issues, including stress, anxiety, phobias, and so many others. It is based on a combined principle of ancient Chinese acupressure and modern psychology. And there's a beautiful website, which is thetappingsolution.com. And I've been, they have so many resources. They have so much even research. So this is something I pulled from their website, which is that EFT tapping lowers the stress hormone cortisol by 43%, which was published in 2012 in the Journal of Nervous and Mental Disease. So how do we do this tapping? Basically, there are 9 points that we tap on, and tapping is just where you're softly just hitting on different parts of your face and your body. So we're just going to tap without actually saying anything. The full process is actually where you're recalling fearful thoughts, whatever's going on in your mind. So we're going to start here, which is the karate chop point. And you're just going to tap 5 to 7 times just on this point. If you can do it with breathing as well, that's okay. If you can't, that's okay too. And then we're going to start tapping in between the eyebrows, just very softly, very gently tapping. Tapping the side of the body, side of the eye, Tapping under the eye, under the nose, under the chin, on your collarbones, just there, under your arms, and back on your head. So I use this a lot, especially when I have a lot of racing thoughts. There is you can, as I said, you can go on the website and see so many videos, but you can use it for anything. So let's start again here, and let's just say, oh my God, I'm so stressed. Let's make the, oh my God, I'm so stressed. I have a workshop to do and I'm teaching all these dentists. Oh my God, I don't know what to do. Oh my God, I don't know. I'm just so afraid. I'm so scared. I'm so scared I'm going to miss something. And what if this is too boring? What if this is too crazy? What if no one likes it? What if I make a mistake? Oh my God, I can't make any mistakes. I need to be perfect. I need everything to go exactly the way I want it. And you can insert any other situation in your life. I really want to make this real for you so that you can actually enjoy the benefits. And then just keep tapping on the points, speaking your mind, whatever it is. We'll go for one more round. And then I start to shift a little bit and I say, well, what if it doesn't have to be perfect? What if whatever I see is whatever is needed at this time? And it's okay. You know, life is not perfect. And I know how to deal with life. So I think it's going to be interesting. I think it's going to be fun. And I'm here just to help others to learn something new, to open their eyes, open their minds. Right? And we can just release and just notice how you feel in your body. I know it's easier for me to breathe. All right, let's keep going. So obviously there are 101 techniques. This is not an exhaustive list. Let's just share some of them. If you do your 5 daily prayers, I encourage you to be fully present in your prayers. Allahu Akbar, qadi adhan hain. Yeah. So we need to be present. And how about we be present while listening to the adhan? Let's do that for now. I'm just going to be quiet for a few moments and just do my breathing and just be present. Bring all my attention inwards. I invite you to notice what's happening with your thoughts. Be aware of the space between your thoughts. Starting to deepen your breath, coming back. That was beautiful. All right. Socializing and laughing. Yeah, for sure that's going to make you feel good. We all know that. Yeah, I'm just reminding you. I know sometimes we can't socialize, but we do our best. Journaling. You can have a gratitude journal where every night before you go to bed, you write 5 to 10 things that you are grateful for in the day. That really, really helps. Or you can do a stream of consciousness journaling, which is where you just sit down and you just write whatever's on your mind. You can do this in the morning as well, or in the evening, whenever you're feeling like so much stuff is happening in your life, just get a piece of paper and a pen and just keep writing. And then throw it away, it doesn't matter, yeah? You're just trying to get it out of your head so that you can be more present, be more aware of what's happening around you, be a better human being. Dancing is a beautiful way as well to get present. When you're really dancing, you can't do anything else, can you? Hypnosis sessions, so you can do those as well. You can listen to brain entrainment music. So I have that on my phone. That is basically where the music is at a certain vibration where it helps you to calm down. Some music also has subliminal messages that speak to you on a subconscious level to calm you down. And I do use those as well, especially when I'm in the middle of homeschooling and I've tried all the techniques and nothing is working. So I get help, yeah. Cold showers are amazing. You can have a cold shower as well. I'm sure that's going to get you completely out of whatever you are going through, depression, anxiety, stress, fear. Just get in there and everything is going to wash off. And of course, massage, yeah. So I leave you with this quote by Oprah Winfrey: breathe, let go, and remind yourself that this very moment is the only one you know you have for sure. Yeah, so in summary, please breathe consciously, find what works for you. You can do it 3 times a day, 365, which means 3 times a day, 6 breaths a minute, 3 times a day, 6 breaths a minute, and then for 5 minutes. All right, so these are my resources. Thank you so much for being here. Thank you for your attention. And I think we're just on time. So if you have any questions, I'm ready to answer them for you now. This is my Instagram. Again, you can contact me. And if you'd like to know more about my classes, I do teach classes in the studio that I'm at right now. It's only for ladies, Studio 33, on Mondays and Wednesdays. But I would love to hear from you. Let's check out the chat. If you have any questions, please let me know. Okay, so everyone's asking about attendance. Beautiful. Just gonna wait a while until everyone gets settled. I would love to know how you're feeling. I'd love to see your beautiful faces, but I see that everyone has switched their cameras off. I'm sure if I haven't a look, see your face is completely relaxed. All those wrinkles are gone. You're welcome. Beautiful smiles on your faces, I hope. Thank you. Thank you. I'm so glad that you got some value out of it. There's so many resources out there. And we have so many local people as well who are teaching these things, who are passionate about these things. So attend classes, yeah. When you take a 60-minute class where all you're doing is what we did, is going to make a complete shift in your life. And if you do it regularly, it's going to shift your whole perception. It's going to shift your whole life. It's going to make you a much better human being. And you will discover things about yourself that you had no idea. You're going to find ways of expressing yourself and finding your power again and finding the joy in life, which is what we all need. Thank you so much. Relaxing. Thank you so much. Thank you. I hope that you can use those techniques. They are 5 simple techniques, and I think they were super simple. So, yeah. Let's check it out. Let's see if I can see. Someone. Nobody has their cameras on. Okay. I used to be very shy and afraid, but I learned to overcome all this. I had stress during COVID, and the result is peptic ulcer. You can reverse it. Yeah, you can reverse it. Just incorporate natural ways. Yeah. And so listen, there's something which I think I mentioned before, but I'm emphasizing again. You don't have to wait to do this at the end of the day or at the end of the week or when you go on vacation. Yeah. Incorporate these in your daily life so it becomes your daily living, so that you're able to shift your state from that of stress and panic. Sometimes, by the way, we're stressed and we don't even know it. Yeah, until people start to get some kind of chronic issues in their body. So I highly recommend having your own routine where you're doing things. So even if you put a timer on your phone, put a timer and say breathing time, yeah, stretching time, visualization time. Just do that for yourself, because when you do it for you, trust me, the whole world will sense how you feel, and they will also calm down. You're going to feel like everything is okay. I'm okay. My family's okay. Life is okay. I can handle it. Yeah. Beautiful. All right, so if none of you have any questions, we can end. Feel free to contact me. You have my contacts. Vertigo issues from stress. Yeah, a lot of issues. Just start with the breathing, because as you can see, the breathing helps your whole body. Your body needs more oxygen. Yeah, and then just having positive messages, you know, just understanding what is the cause of the vertigo, like what is happening in your mind. Are you feeling out of control? Are you feeling that the world is spinning around you? Are you feeling that, you know, unable to deal with life? So again, you do the visualization, you just calm yourself down and say, you know what, I can handle whatever comes. God is going to take care of me. I just have to take care of myself. I take it easy. And you can, you know, Google some things, and maybe there's some postures that you can do that can help you with the vertigo. But I know that it's definitely related to circulation. Yeah, head space, head circulation. So yeah, do more breathing. Do the tapping as well. I'm sure you'll find a video for vertigo and tapping. There's videos and everything. Yeah, whatever you have, just Google it, put it on YouTube, just write tapping for vertigo, and you're going to find it, I'm sure. All right. So thank you so much once again. I appreciate your time and your energy. And with that, I will leave you, and we will close the meeting. All right. Have a beautiful, beautiful day.
Thank you, Dr. Farah, for the very informative and beneficial presentation. Thank you for your great effort and time. We'd like to send you a certificate of appreciation and recognition of your valuable contribution in this webinar. And I would also like to thank all the attendees for their attendance. And you will receive your certificate of attendance soon, so please check your email inbox junk. Hope to meet you all again at your upcoming other events.
Thank you so much. Thank you. Bye-bye.